As Europe's population ages, the demand for clinical care is increasing, yet healthcare systems face a specific retention crisis. Male nurses are leaving the profession at higher rates than their female colleagues, responding to the heavy emotional and physical strain of the job. To address this, administrators often lean on a specific human resources assumption, the idea that the strain of demanding work can be effectively offset if the organization provides enough compensation or recognition. This logic is formalized in the effort-reward imbalance model, a framework that has shaped occupational health policy for decades. The model tracks extrinsic effort, things like time pressure and physical demands, against extrinsic rewards, which include salary, professional esteem, and job security. The central question is whether these rewards actually serve as a buffer against burnout, or if this social exchange model fails to account for the actual physiological toll of clinical nursing. To test this, researchers conducted a massive study following 1,421 male nurses across 7 European countries. They used a 2-wave, 1-year longitudinal design. By tracking individuals over 12 months, they saw how work conditions predicted health outcomes. Specifically, the study measured 2 outcomes. First, vital exhaustion, and work-home interference, where job stress bleeds into private life. The results showed that the core of the ERI model, the ratio between effort and reward, failed to provide unique predictive power. The interaction didn't explain the nurse's exhaustion any better than simply looking at their workload. To stop premature turnover, administrators must shift their focus. The evidence points to a single dominant factor: the sheer volume of raw effort. The researchers used structural equation modeling to map how these work variables interacted over that 1-year gap. They started by testing the independent effects of effort and reward on exhaustion, separate from any ratio. The data for effort was immediate. It showed a massive correlation with vital exhaustion from the very beginning of the study. This wasn't just a temporary spike. The effort a nurse put in at the start of the year was a positive predictor of their exhaustion levels a full year later. Lack of reward showed a different pattern. It had no immediate correlation with exhaustion, showing only a smaller, delayed effect at the 1-year mark. The raw demands of the clinic are the most significant drivers of exhaustion. They operate largely independently of how well the nurse is compensated or praised. This leads to the critical test of ERI model's central premise, the idea that an imbalance, specifically high effort combined with low reward, causes a unique, amplified level of strain. To prove this, researchers added an imbalance ratio variable to see if it explained any additional exhaustion that direct effects missed. The statistical evidence was clear. Adding the ratio explained no additional variance. The interaction term was completely redundant. The model fit didn't improve. Mathematically, the ratio didn't add anything to our understanding of why these nurses were burning out. This null finding reflects the reality of energy depletion. When subjected to extreme job demands, the body triggers a physiological process called allostatic load. While rewards like higher pay or professional respect are valuable, they don't appear to buffer the cellular and physical toll of that energy expenditure. The data suggests that no amount of professional recognition can stop the body from breaking down under the weight of excessive workload. The core assumption that rewards can balance out high effort is not supported by these longitudinal outcomes. The researchers then looked at how this clinical stress infiltrates a nurse's home life through work-home interference. They tested 2 paths. One suggests that home life interference prevents a nurse from recovering, which leads to exhaustion. The other suggests that work-induced exhaustion is what causes the problems at home. The first path, the idea that interference at home causes later exhaustion, turned out to be non-significant. Home stress wasn't the driver of burnout in this study. Instead, the data supported the dual process hypothesis. It suggested that work demands cause exhaustion first, and that exhaustion then bleeds into the private domain. The numbers show that exhaustion at the start of the year significantly predicted increased work-home interference later. This reveals a clear chain reaction. Job effort leads to vital exhaustion, which then degrades the nurse's personal life. In this model, burnout is a directional process. It originates at the workplace through excessive effort and terminates in disrupting the nurse's private life. There was, however, a complication in how reward was measured across different European cultures. The study used a test for metric measurement invariance to see if the concept of a reward meant the same thing to a nurse in Italy as it did to one in Germany.
The measurement tool for rewards failed this test. The data showed that nurses in different countries valued different things. For some, job security was the primary driver of the feeling of being rewarded. For others, it was professional esteem or career opportunities. National values, welfare systems, and local economic conditions change what a worker defines as a reward. This means healthcare organizations cannot rely on standardized global reward programs. What feels like a fair exchange in one country may not translate to another. These findings point away from the ERI model toward flexible frameworks like the job demands resources model. In this view, effort and reward act as parallel tracks. They are both important, but they don't multiply each other's effects in the way the ERI model suggests. For healthcare administrators, the practical implication of this study is clear. To prevent male nurses from leaving, the focus must be on reducing the task load, limiting mandatory overtime, and addressing the job's structural demands. Recognition and pay are necessary, but they cannot replace the need for a manageable workload. If the work itself remains too demanding, the workforce will continue facing the risk of collapse.